Hello everyone, welcome back to my YouTube channel once again. So today I'm going to discuss about the most important topic, which is dental caries. It will be useful for your oral pathology, oral medicine, in entire dentistry you can say. Okay, I'm going to tell you in detail about what is dental caries, how it is caused, everything I'm going to explain in this video. So till the end stay tuned so that you can completely understand what is dental caries. So in this video today, what we are going to know is about the dental caries, and you will be knowing about the etiology, pathogenesis, and clinical features. Then its histopathological features. Then you are going to see about the what 10-mark question, how you have to write, and 5-mark question, what you have to write. Okay, so you are going to learn everything in this video. So stay till the end. Okay, so introduction here, mostly common oral disease. This is the most common oral disease. Okay, so here this is the one of the most frequently asked question. Okay, exam importance is very high for this question, and for the clinical practice it is the basic one you have to know about this topic. Okay, so let's define what is dental caries. So nothing but it is a microbial disease of calcified tissues of the teeth, okay, characterized by the demineralization of inorganic part followed by destruction of organic matrix. Okay, here the mainly it is a microbial disease. Okay, so here the demineralization of inorganic part you can see. Okay, and the destruction of organic matrix you can see in this dental caries. Okay, so next we are going to see historic concept, like how what people, early people, what they used to think, how dental caries used to be there, why it is happening. So there is one theory that was worm theory. Okay, it basically it state that caries caused by tooth worm. Okay, they used to think, in this theory they used to think that some worm is there in the teeth that is causing the dental caries. Okay, then another theory was that another theory was chemical theory. Okay, acid theory. Okay, acid dissolved tooth structure. People used to think acid used to dissolve the tooth structures. Okay, then one more theory was proteolytic theory. So mainly here the people here used to, in this theory people used to think that protein destroyed first. Okay, the protein which is formed the tooth get destroyed, so the dental caries happen. Okay, next was the theory was gelatinous theory. Okay, in this theory organic destruction plus gelatination of materials. Okay, they used to think like this. So then the modern people, what they have to think, caries is multifactorial disease involving tooth, microorganism, diet, and time. This was mostly acceptable because here the tooth microorganism is there from caused by the diet is also right, and the timing also there. Okay, so the basically what is the etiology of this? Etiology is nothing but like the infection caused by host, bacteria, diet, and the time. Okay, so next is like what is etiology? Host factor, what are this? What you can see here is deep patent fissure, you can see poor enamel quality, you can see, then malignant and crown malocclusion or malalignment of the tooth. Okay, you can see crowding. Okay, because of that also caries can happen. So in first picture you can see the patent fissure, in next picture you can see is poor enamel quality, the enamel quality get very poor. Okay, then is crowding, that is like malfunctioning or malpositioning of the tooth. Okay, so next is microorganism. For most important is streptococcus mutans is the most important organism. Next is lactobacillus species, then actinomycin species are the microorganism that causes the tooth decay. Okay, so next diet and time. In here sucrose is the most carcinogenic. All sugar is there, in that most important is like sucrose, it causes, it is most carcinogenic. Okay, next is sticky food, frequently eating of snacks and prolonged exposure time. So the food gets stick on the tooth, and we are not going to clean that tooth at that moment, so it will be there for a prolonged time, and that causes the tooth decay. Okay, next there is a Kearns triad. Okay, in this you can see bacteria, tooth, and the diet, how they have defined. Okay, So next is pathogenesis, how it is caused. Okay, one is acidogenic theory and demineralization begin when pH falls below the critical level 5.5. If the pH level is below 5.5, then the dental caries might occur. Okay, so pathogenesis is how you will take the sugar. Okay, so what happen after taking the sugar? Bacteria metabolism will take place, then that causes the acid production. So acid is produced. Okay, then the pH of the tooth is below the 5.5. So next, that causes the enamel demineralization. Enamel get demineralized, then it enter the dentine involvement, then pulpal involvement. This is how the tooth decay occur. Okay, so this is the flowchart. You can see here bacteria biofilm. Okay, then you can see acid production, then you can see the saliva, how they are acting in it and causing the dental caries. Okay, so next is type of dental caries according to the location. Okay, if according to the location, there is pit and fissure caries, smooth surface caries, root caries. Okay, you can see the pit and fissure caries you have seen before also. Here also first diagram you can see is the pit and fissure. Okay, then the smooth surface caries, then is the root caries. Okay, it will happen near the root. Okay, next is type of dental caries rate. Okay, there is a acute caries, there is a chronic caries, and there is a rampant caries. Rampant caries usually occur in the children's or xerostomia patients. Okay, so acute caries is like minor. Okay, like chronic matlab they prolong like for a longer duration time. On the rampant caries you can see in the third diagram. Okay, so next is clinical features. Enamel caries, how enamel caries, there is a white lesion. Okay, there is a white spot lesions will be seeing. Okay, like this in the picture. Okay, then chalky appearance, like chalk like appearance you can see in the second picture. You can see usually asymptomatic. This is okay, this is how the enamel caries look. Okay, so next is dentine caries. Okay, here you can see brown or black cavitation. There is a deep brown and black cavitation, sensitive to sweet and cold. If the caries enter the dentine, you can see the sensitivity. If in the enamel it don't get so much sensitivity, but in the dentine you can feel the sensitivity while you are eating sweet products or cold items. Okay, so next is pulpal stage. Here severe pain. Okay, usually this pain will be in the night leading to the pulpitis. Okay, here the caries has entered the enamel, from enamel it has gone to dentine to the pulp, it has reached the pulp. So here you can see the severe pain. Usually pain occur during the nights and lead to pulpitis. Okay, so histopathology, in histology in slide, how you can see the enamel caries is cone shaped lesion. Okay, here you can see the cone shaped lesion. Okay, base at the surface will be the base of this. Okay, and apex towards the DEJ, the caries will be entering the DEJ. So it is in the cone shaped lesion, it is a cone shaped lesion. Enamel caries is basically the cone shaped lesion. So base will be, it will be cone shaped matlab triangle. Okay, so the triangle ka base will be the outer surface. Okay, so then the inner surface will be the towards the DEJ. Okay, so next you can see in the diagram also, histologically you have to draw the diagram like this. You can see the triangle shape. Okay, base towards the outer surface, base towards the outer surface, and pointing towards the DEJ, it is entering the DEJ. Okay, so zones of enamel caries, there is a surface zone, body of the lesion, dark zone, translucent zone. Okay, so this is how the body of the lesion you can see, dark zone you can see, translucent zone you can see, surface zone you can see here. Okay, so next is like here also you can see easily you can make out. Okay, body of the lesion, surface zone, dark zone, translucent zone. Okay, it is going towards the DEJ, base is outer surface and it is entering the, so it is cone shaped lesion. It is in enamel caries is a cone shaped lesion. Okay, so now dental caries, dentine caries, how it will be seeing in histopathically, it is infected dentine and affected dentine. Okay, infected dentine and affected dentine. So infected dentine, you can see the black color, that is infected dentine. The outer the red one you can see is affected dentine, that is reparative dentine. Okay, that you can see a round color, that one is bacterial plaque. Okay, that has entered, so it was caused the infected dentine, and in below that is the affected dentine. So what is infected dentine? That will be the soft, infected dentine will be the soft, bacteria will be present, then irreversible, it can be reversed back, it can be curable. Affected dentine, that will be the hard one, no bacteria, reversible. Okay, so this is the difference between affected and infected. Infected will be the soft and affected hard. So infected mein kya hoga, like bacteria present, and affected may no bacteria is there. Okay, that is infected will be the irreversible, affected will be the reversible. So next sequence of pulpitis, how it will be. First it will be a pulpitis, then periapical abscess, then periapical granuloma, then radicular cyst will happen near the pulp. Okay, so first will be the pulpitis, periapical abscess, periapical abscess, then periapical granuloma, then will be the uh, radicular cyst. Okay, so this is the sequence of the dental caries. Okay, enamel, then dentin, then pulpitis, then periapical abscess. Okay, see, this is the sequel of the dental caries. You can see here. Okay, enamel caries, how it will enter the dentinal caries, then it will enter the pulp, then it will be acute or chronic. Okay, then apical periodontitis. Okay, in there you will be periapical abscess or periapical granuloma. A periapical abscess is acute, periapical granuloma is the chronic one. Okay, that both will lead to osteomyelitis. Okay, then osteomyelitis to periosteal. Okay, then cellulitis and abscess, this is reversible. Okay, so periapical cyst will be forming the periapical granuloma. So what will happen? Periapical cyst. Okay, so next is how you will prevent it. Proper brushing techniques you should know while you are brushing. Okay, then fluoride toothpaste you should use, then diet modification you have to do. If you are using a sticky food, you have to gargle the oral cavity or brush it immediately after eating the food. Okay, then you have to go for the community level. If you see the prevention, water fluoridation, pit and fissure sealant you have to do, then school dental health program you have to conduct. Okay, to prevent the dental caries. So this is the what you have to write in the exam for the 10 mark is definition, etiology, prevention, then pathology. Okay, pathogenesis is the most important things they will be asking you in the examination. Okay, for 5 mark you can see it, for 10 mark or 5 mark both it is there. Definition, etiology, clinical features, then histopathology, prevention, pathogenesis is the most important. And in viva they might be asking the most carcinogenous sugar is sucrose. Okay, critical pH is 5.5, main bacteria is Staphylococcus mutans. Okay, reversible stage is enamel caries. Okay, in enamel caries you can reverse back the caries one. Okay, so summary, basically the dental caries is preventable. You can prevent the caries in the initial stage. Early diagnosis is the most important, very important. This is the most important topic for your examination. Okay, thank you. This is all about your dental caries. Okay, if you like the video, so share, subscribe and like this video. So next topic I am going to take up with the leukoplakia. That will be the most important topic, one of the most important topic. Okay, so I'll be taking that one in the next video. Okay, thank you for watching this video. Do like, share and subscribe my channel. Thank you.